And get started with some of our background slides. This is just a couple slides before we switch over to the demo. So until we launched the Congressional District Health Dashboard in January 2023, there really was not a publicly available resource for rigorous nonpartisan data on health and conditions that affect health. I previously worked in advocacy and so know this firsthand that this is a really valuable resource for advocates and potentially for members' offices as well, but certainly from the advocacy side based on my experience. Our website is really based on the idea of the power of data to reveal challenges and assets in communities, to inform effective policy solutions, and also to be used to hold leaders accountable. We know that data alone can't change policy, but we do think that it's an important ingredient. Our audiences include elected officials and their staff, advocates, journalists, researchers, and the general public. It builds on our experience developing and leading the City Health Dashboard, which similarly provides health and health drivers of data on drivers of health at a different geographic level from what it's normally available at. Most of these data are available at state and county levels, as well as national, of course, but not as much at the congressional and city levels. So we launched this website to be useful to folks working more in the congressional advocacy space. We're based at the NYU Grossman School of Medicine in the Department of Population Health, and this project is funded by Robert Wood Johnson Foundation, and they also serve as a partner with us to design and promote our work. So I've talked a little bit about our measures. This is actually a slide showing all of the measures on the dashboard if you haven't checked it out before. I find it useful to pause for a moment here because this is a lot of text. We have our measures grouped into 5 domains. One is health outcomes. This is like what you would typically see for real like health related data. Social and economic factors, we often think of these as the drivers of the health outcomes. Health behaviors is a smaller category we have here because individual behaviors certainly still influence health outcomes. Physical environment, we have a couple of sort of bigger picture environmental measures. And then finally, clinical care, which is, of course, an important part of one's overall health access to care. So each of these has a little, or some of these have a little symbol next to them that you can see. This is information that you may or may not know, but for all of our measures, we do provide the data at the congressional district level. And for measures where it's appropriate or where the data allows us to, we also have demographic breakdowns available by race and ethnicity, sex, or age, all 3 if the data makes sense for those. And then we also have census tract level data available. So you can look at smaller geographic levels than the congressional district. You can look within congressional districts at different neighborhoods if you know the census tracts associated with those neighborhoods, and you can look those things up. That also just helps to see variation within districts and can help you prioritize resources within districts to areas that maybe are suffering more or have the opportunity for more improvement. So just to kind of take a step back from all the measures that we just looked at, how did we decide to put these measures on the website? All of our measures go through really a rigorous process for going on the website. We want data for all congressional districts, so we use national data sets. We look for rigorous methods underlying the original data collection. All of our measures reflect public health priorities. We also look for measures that can be updated regularly because we know it's important for folks to know what's going on and to see changes over time. And then finally, they are all balanced across the 5 overarching domains that we just talked about. So before I go over to the site launch, I did mention that we're based at NYU Langone Health. We're funded by Robert Wood Johnson Foundation. And I also just want to call out Bipartisan Policy Center and the Center on Budget and Policy Priorities were instrumental in thinking through the design of this website, the data that we decided to display, and the driving the launch of the site. I guess any questions, Avalon, before I switch over to the. Okay, great. If folks want to put the district that you're working in the chat, I can use districts where you're located in the demo. I am from Indiana's 8th district. See, Avalon put in New York 12. I'd be happy to tailor it to some of you all. Okay, New York 7, thank you. I'm going to close out of this PowerPoint and hope that you all can put your districts in the chat while I'm switching over to the website. We'll start with New York 7. Thank you, Olivia. If anyone else wants to put the district that you're from or that you're working in, I'd be happy to use it. So this is our homepage. It's really simple, Congressional District Health Dashboard.org. You can, if you don't bookmark us, that if you Google Congressional District Health Dashboard, it'll pop up. So our homepage just really asks you, hey, what district do you want to look at? And you can type it in or you can type in your address. Thanks for putting districts in the chat. Thanks, Nicole. Okay, so we've got New York 7th. I'm going to start with that one. And when you select a district from the homepage, it's going to take you to the health snapshot for that district. So this is all 40 measures that we have on the site will show up on this page in alphabetical order, and we'll give you the estimate. So it's a snapshot of your district for every measure we have on the dashboard. So for example, I'm going to look at binge drinking. This is one of the health behavior metrics. This says 18.7% of adults report binge drinking in the past 30 days in New York. So you can sort of toggle around here to see some different information. If I go over the I can see that the data source for this metric, and also that it was the data was collected or calculated based on 2022 data. So, and then I can also look and see in the US comparison column, how is my district doing, or the district that I'm looking at, how does that compare to the average of congressional districts across the country? For binge drinking, it's around the US average, and I can hover over this to see what that number is just for a quick comparison. If I don't want to necessarily know the number, but just kind of want to zoom out and see, you can see these symbols are changing over here. The orange triangle means that it's around the US average. The green circle is better than the US average. And then the red square is worse than the US average. So we can see some variation across the different metrics within the district. There's the comparison legend over here. And then you can also, just as an example, if you're really only interested in certain measures on this page, you can come over here and filter by domain or even by a specific measure. So say I want to look at maybe some women's health stuff. I could look at teen births, breast cancer. I'm seeing prenatal care. I might also just do Medicaid enrollment. And you can kind of see quickly just the metrics that you're interested in. The other thing you can do on this page that may be useful to your work is to print the page, and it will do a nice printer-friendly PDF for you. You can full screenshots, of course, of things, but this will help you if you want to take printouts to meetings about just sort of what the status of the district is, you can do that. The other thing I'm going to share with you on our snapshots page is the district facts. So if you click on district facts for any district that you're in or state, you can see the population, the breakdown by age, the population by race and ethnicity, and you can also see this feature that we have where you can look at what cities we have on the Congressional District Health Dashboard that are also in New York 7th. New York is sort of a funny one to do this for because, of course, New York City is well, more like New York 7th District is inside New York City. But on other cities, or other districts, you would be able to see what cities, so that if you're working perhaps with a mayor and with a congressperson about a particular issue, you can actually pull the values or the estimates for the metrics of interest at both geographic levels. It can, I think, be a good resource to know that linkage is there to our other site. Finally, this information at the bottom is just another useful resource for anyone with the member of Congress for the district and the senators for the state. I'm going to just scroll back up. The things I'm going to walk us through today are each of these main tabs. There's two ways to get to the next tab from here. You can either click on the metric that you're looking at. If I click on prenatal care, it'll take me to the map for prenatal care. And I can also go from here. So I'm going to show you first to go just from here. So I'll click on prenatal care. This is going to take a second to load. There we go. And I'm going to zoom out a little bit just to get an idea of the surrounding areas. So what's really nice on the metric map is that there's an orange outline around New York 7th District, but just based on looking at the map, I can actually explore surrounding districts and neighborhoods really easily in a couple of different ways. One, I can click and say, oh, okay, these are the Manhattan and other Brooklyn districts, and I can see those estimates. I can also just look at, based on color, what some of the variation is around. There's not always a lot of variation depending on the metric and the density of the population. You won't necessarily see this much variation, but there's clearly significant variation in access to prenatal care in the New York area. Just, I blinked and I could see that based on the colors. I'll take us up just to the scale bar for reference. It looks like, based on looking at the scale bar, that the New York 7th estimate for prenatal care access is really similar to the US average. I can tell that because the orange bar is New York 7th and the little arrow down here is indicating the US average. And that'll switch, depending on whether on whatever district you're in, you'll be able to tell. I might try to pick a district that has this is New Jersey 10th. I'm going to switch to New Jersey 10th just for a point of reference. So you can see the orange bar change significantly compared to the US average. Just for our demo, I'll switch back to New York 7th. So a couple things that I think can help guide you as you're thinking about, what do you want to explore on this page? I've already shown you that you can click around the map to look at different districts. I'll talk a little bit about how we use colors on our website as well. Typically the darker colors indicate worse health outcomes and the lighter colors indicate better health outcomes. And anytime you see a scale bar, it'll tell you if higher or lower values have better outcomes. So there are, a different metric would have actually the reverse, that a higher value would mean a worse outcome. For example, what percentage of the population has diabetes? Well, if that's a higher percentage, it's going to be uh, worse health outcomes, and a lower percentage would be better health outcomes, but the color will match. So if you switch to diabetes, which we can do here, um, when the map loads, you'll see the colors still say that darker would be worse, even though the scale bar has kind of switched. So just some visual clues for you as you're exploring the site. Look to the scale bar, look to the colors. The map labels and scale bar labels will help you be able to sort of parse through and interpret the data. The other thing you can do is on this site, so we've changed the metric. You can change the metric time period if you wanted to look at change over time. Prenatal care, I've looked at it, or no, I guess I'm on diabetes now, but diabetes certainly can change over time. A lot of these metrics, you're not necessarily going to expect to see a ton of fluctuation year to year, but you may see some. And so it's an important tool for you to be able to have access to. The other thing that you might be interested in is comparing on your scale bar the district value to the state value. That may be of interest. So just showing you that you can do that here as well. And then another thing that I mentioned before is it's, about almost 75% of our metrics have census tract values. And so if you want to look at census tract values for the district that you're looking at, we're still looking at New York 7th District, you can select Show Census Tract under Map Boundaries, and then zoom in, and you can actually see even greater variation very quickly within New York 7th District. And similarly with the district level map, you can click around and actually see what those differences are. So it looks like in some places, diabetes is as high as among 20% of the adult population and as low as 3 or 4% in other areas. The other things on this page before I move on are that you can download the map and the scale bar. And again, those can be used just like print this page on the health snapshots. You can use the maps and the scale bars in presentations that you're using, or other ways of sharing these data with folks that you may be interested in. Okay, for the next tab up here that I'm going to share with you, we're going to switch districts. So for metrics by demographics, I'm going to switch to Michigan's 4th district. So what comes up here is a metric selector, and immediately this is telling us these are the metrics for which you can see metrics by demographics. So if you can click on it, there's demographic data. If you can't click on it, there's not demographic data. I think unemployment, which is one of our social and economic factors, is a good example of metrics by demographics because we have all 3 categories. So you have the sex breakdown for unemployment. You can see that that there's a little variation there. You can see more variation among race and ethnicity groups for unemployment in Michigan's 4th district. And then you can also see a lot of variation by age group. Any questions on this before we keep going? Okay. So each of these has the district total at the top, and then the scale bars, do represent, you can like visually find the lower and the higher and the variation pretty quickly. So we do try to use really simple data visualization around the site so that folks can find what they're looking for. Let's see. I want to actually toggle back to metric maps. I know I said we were moving on, but I just want to show you if, we had started on the home page and then we went to health snapshots. If I wanted to say, oh, I think I'm actually not interested in a particular district, but I'm actually interested in a health issue and in exploring one of the metrics that we have, I might start instead on the metric maps tab, and then it's going to load a national map for whatever metric that is. If there's any metrics that folks want to look at, please let me know. I'm going to open our Medicaid enrollment metric for this. So now, this has populated the national metric map for Medicaid enrollment. And similarly to when we were, zoomed in the New York area, you can click around and see what these different colors mean on the map for different areas in the country. If you wanted to see a denser urban area, you definitely have to zoom in to be able to click on those, to select the district that you're really interested in. I think I'll go to Pennsylvania's 9th district, just to get another district in here. Oh, I was so close. I got Pennsylvania 10th. Nope, I'm gonna have to zoom in. I guess you guys are seeing my map navigation skills. I'm gonna just type it up here instead of trying to zoom and click correctly, and then I'll show you another way you can find what you're looking for. So once again, we're back at this metric map view. I won't spend a lot of other time on here, but this is really just to show you the kinds of 2 entry points. One is the district focused way, in where I say I want to look at this district and kind of get the big picture of what's going on in that district. And the other way is to say, I think I'm interested in this particular health issue and I want to know what's going on, big picture before I maybe zoom in and navigate to the district that I'm interested in. So next I'm going to go to compare districts. This is the last sort of feature that we have that gives you the opportunity to explore different metrics and measures and to compare different districts to each other. We can use Pennsylvania 9th and New Jersey 12th for this one. Looking at our metrics, maybe I'll pick rent burden. This is a problem for many folks across the country. So I'll start with Pennsylvania 9th. So the first thing that pops up is I've got Pennsylvania 9th plugged in over here, and it's immediately given me a scale bar for Pennsylvania 9th and what we call a card, where I have the scale bar, a sense-making statement that tells me what does this number mean in a sentence, and a little map with the color associated with the estimate for that area, the data source, and also the data year. So this is like a really small graphic that you can use again in any of your materials or any of your work that you can just pull from here that says this is the deal, and this is everything you might want to know just about this metric in this district. Now, if you wanted to look at other districts or even the state, you can start to add those. So now I'm looking at the US average, Pennsylvania's 9th district, Pennsylvania. Maybe I want to add Pennsylvania 10th. Oh, okay, there's actually a lot of statewide variation. There's probably districts that are a little higher because the average for the state is higher than both of the districts I've selected. And higher in this case, because it's darker, we know that a higher value would be worse. And we also have this clue over here that says lower values have better outcomes. I said I was going to pull in New Jersey 12th. You're not an adjacent district, I don't think, but we'll add you into the mix. So then we have New Jersey's 12th to compare with. So New Jersey's 12th looks like it's closer to the US average. And then also, again, we have these like cards down here that are populating. If you go to print this page, it will likewise load a PDF. We set it up so that it will keep, if it's a card, it'll keep it on one page. So it won't split it across pages. So you're really able to, again, use these materials in your work and not just have to necessarily use them only on the website. So other things you can do here, like on any of our metric exploration pages, you can change the metric time period that you're interested in. You can toggle here and see, hey, I want to know more about this metric. For all of our metrics, we have a background resource for you on them. If I click here, it'll take me to this metrics background page. So I'll just show you what one of those looks like. On this page, you can see what rent burden measures. It's the percentage of households where 30% or greater percent of income is spent on rent, the data source for that, why we measure it, why we think it's a good measure, why we think it might be, a challenging measure or maybe has some limitations to how you can apply it. This one, as rent burden does not take into account other expenses such as debt or medical emergencies. So there are a lot of reasons why folks may have, other expenses that are a bigger deal than rent, but this is an important one. If you're more interested in the data stuff, there are more resources here. We link to our technical document, and we have some information about how it's calculated. So I'm going to just go back to the metrics background page. This is the other way to get to this page. And you can see the full list of metric background information for every metric we have on the site. So just clicking on another one, colorectal cancer deaths. This is deaths due to colorectal cancer per 100,000 population. The source is National Vital Statistics. We also have the scale bar with the US average. So just a little bit of background for each one. These are intentionally not really long, just so they can be user-friendly for folks. And then finally, before we wrap up, I'll just show you a couple other places where you can find information about us. This is our About page. It just, says who we are and links to a couple resources. This is our blog and media page. We just recently posted a blog on understanding rates. So if you're, again, kind of interested in how our mortality and natality measures work, this blog will help you understand why we use that, per 100,000 population language and the importance of being able to compare across population groups. And then last, if you're interested in downloading our data, you can go to access the data here. If you've never been to this page, what will pop up is a little survey for you to fill out about why you want to download the data. We don't do anything with that except just understand why users might be interested in it, and it helps us figure out if this is an important area of the site to keep working on and making it user-friendly. We want to know sort of who's using it and what you might be using it for. Here, the resources are the data dictionary and the technical document. Again, these are sort of more the behind the scenes. How is our data? Where do we get our data from? How do we calculate it? If you wanted to replicate these methods, you might be able to do that using these resources. And then finally, down here, you can download data by selecting, you can select different metrics or geographic area, or you can say, oh, I know I want, everything for New Jersey. Oh, now that I'm here, I actually only want, a couple. So you can sort of sort and filter either way. And I think it's a pretty good system. You can download for states, congressional districts, and for tracks if the data is available. I guess I could go back to here just to say that we welcome you to stay in touch with us. Email us at our info at email if you have questions. Real people answer the email. It'll get forwarded to me. And if you're not already subscribed to our newsletter, you can subscribe at that link. I think Avalon, can you put some of these links in the chat? Great. And yeah, if you want to follow us on LinkedIn, please do. And otherwise, I'm open for any questions that folks have, or if you're interested in talking about how you might use the data in your work, we certainly want to hear about it. Thank you.